Welcome to a short introduction about MockOSCE. This is aimed at medical students preparing for end-of-year exams. What is an OSCE? An OSCE stands for Objective Structured Clinical Exam. What do different exams test? A written exam, for instance a multiple choice paper, tests your medical knowledge and reasoning, whilst an OSCE tests your knowledge but also your clinical skills and interpretation. Broken down, this includes all the skills which will be assessed in your end-of-year exams, so history taking, differential formation, management and prescribing, and communication skills. Ideally, an OSCE station has 3 people: the candidate, a patient role player, and an examiner with a mark sheet. Sometimes there are not enough people, so the examiner will play the role of the patient as well as marking the station. This slide shows the layout of a typical OSCE. Note that both candidate and role player are seated. The chairs are angled towards each other and the candidate is demonstrating open body language. Remember, the key to good OSCE performance is practice. You can find lots of useful OSCE stations at www.mockosce.com and access is totally free. There is a wide range of topics to choose from, including paediatrics. This will be very useful for your end-of-year exams. Remember, mock means to make a replica or imitation of something. This is all about practice to make you a better student and doctor. Now let's run through an example. We have selected a history taking about a vomiting infant from the MockOSCE website. One student will be the candidate. He will pretend to be a doctor or medical student, depending on the task. The benefit of being a candidate is improving your role-playing skills, learning and practicing medical consultation skills, and learning how to receive and use feedback. Click on the Candidate Ped History 5 link to open the scenario information. Prior to commencing the consultation, make sure you read all the details thoroughly. It is very important to be clear what your task is. For instance, in this case, your task is, please take a full medical history from Larry's carer. You also have information about the time allowed, your role, the patient's name, age, gender, and their carer. The other student will play the role of the patient. The benefits of being a simulated patient are to improve your role-playing skills, to learn how to think like an examiner, to experience what it is like to be a patient, to observe good and bad examples from your peers, and to learn how to give constructive feedback. The patient role player can click on Patient Ped History 5 link to open their instructions. The instructions have this format. Again, the basic demographic details, but then also key role player information. There is often quite a lot of backstory for the patient. It is helpful if you can read this thoroughly. The more you get into character, the more fun you will have and the better practice it will be for the candidate. Remember to speak like a patient and give sensible answers. Don't lead the patient, i.e. give them too much information, but equally don't be obstructive. And remember to take notes so that you can give constructive feedback at the end of the scenario. Feedback that you should give would ideally be specific, be constructive but not unfair, be positive about things that have gone well, but also honest about areas of improvement. No one can improve if they are told they are already perfect. The third part of the equation is the examiner. In the real exam, this will be one of the academic staff. During MockOSCE, the patient role player may also need to play the examiner. You can click on Marksheet Ped History 5 to open this. The marksheet lays out the ideal order and content of the station and has columns where you can mark the candidate. It is helpful to review this marksheet together at the end of the MockOSCE station to see what you remembered or forgot, and so you can learn from it. Remember, the road to OSCE success is practice, practice, practice. Reading will not help you to pass the OSCE. You need to practice your skills. So finally, some tips for practice. Find a study partner and practice together. You can use MockOSCE.com and other websites to find materials to practice. You can create your own cases from those that you see on the ward. Creating cases sometimes gives you an insight into how examiners develop your real cases for the exam. Give each other honest feedback in order to improve. And even if it is difficult, practice in the language you will be examined in. So, for instance, English. So attending a MockOSCE session is your opportunity to practice. And this is how the MockOSCE session would be run. So usually a short introduction and explanation of the session. Step 1, you'll be split into pairs. Step 2, you will be given the role either of candidate or of role player. You'll be given information of the case, either as a PowerPoint or from a book. Everyone in the group will study the candidate task together and any questions will be addressed. Step 5, candidates will leave the room and role players will have 10 minutes to read the instructions for the first case. Step 6, you will have 13 minutes to complete the task. When the alarm goes off, the scenario stops. And step 7 is general discussion of the challenges of the case. Step 8, the scenario marksheet will be used to guide feedback and discussion. Good luck with your MockOSCE practice. Remember, the more you practice and the more you get involved and pretend that you're in a real situation, the easier it will be in your exam and in real life. Thank you very much.